Hi. So in relation to the video that I made about DVT, the question is, what happens after a DVT or a thrombosis is dislodged? Well, let me share an experience with you. A couple of years ago, I had a patient. He was a senior analyst of a major company. He was vacationing with his family, and when his ATV tipped over backwards, he fell backwards and lost consciousness. He became immobile from neck down, and it was found out later on that he severed his cervical spine. When he came to rehab, he was total care, meaning he was totally dependent on all activities of daily living. When I worked bedside, he was basically my patient every time I worked. So we sort of formed a bond. Him, his family. I remember one day I walked in and he was listening to an 80s music in his playlist, and I told him I love 80s music. And he was teasing me because at that point he was listening to this song, and he said he will always be reminded of me whenever he hears that song. And then one day I walked in and assessed him. He kind of looked weird. His coloring was kind of dusky, sort of grayish, and his skin was clammy. And I listened to him. His heartbeat was kind of erratic, irregular, and rapid. And his his oxygen saturation was kind of low. And then he was having some cough all of a sudden. He did verbalize that he was feeling some sort of heaviness on his chest. So I notified the attending, and immediately he was sent to the ER because they suspected pulmonary embolism. Now, a pulmonary embolism, an embolism is a blood clot that got dislodged as a DVT, as a deep vein thrombosis, and it traveled through the bloodstream and it got lodged in the lungs. So when this happens, the blood clot blocks blood flow from the heart to the lungs. That leads to drop in blood oxygen, and it makes it hard for the heart to pump because of that blockage. This is considered a medical emergency, and it needs to be addressed, or it needs to be treated with a thrombolytic, which is a blood clot buster in a hospital setting. Now back to that patient, we found out, so we transferred him to the ER, and then that night we found out he passed away, which was devastating for all the staff. So one asks, how do we prevent pulmonary embolism? Well, a pulmonary embolism can be prevented by preventing a deep vein thrombosis. Now, how do we prevent deep vein thrombosis? By staying active and wearing compression socks. Stay hydrated, quit smoking, and there's a lot of things. But what's important here is, if you see those signs of deep vein thrombosis, go ahead and take yourself or your family member to the hospital to get treated. And yes, whenever I hear that song, I still tear up every time because I can still see his face vividly, saying that he's going to remember me, or he will remember me every time he hears that song.